those community folks. We had the elevator explosion in Russell. We had the football player who collapsed down in Wallace County. There was a situation in Sherman County where an infant was brought into the emergency room and didn't survive. And those are all very, very traumatic, impactful situations. So one of the things that we ask of county commissioners is, if you ever become aware of a situation in your county, please don't hesitate to reach out. We will always then contact whichever group is involved, if it's the ambulance service or the fire department or law enforcement or schools or hospitals. We'll contact them, explain what we've learned, and indicate that we want to come out and be helpful if they want us. We're not going to just show up. And sometimes we coordinate with local clergy or other supports that are already in the area. And so if they want us, then we're going to be there. If they say, hey, we think we're doing okay, then we'll just say, okay, great. If you need us in the next day or so, don't hesitate. Because sometimes, like, we had a suicide in a school in Waukene, and the school counselors and administrators and the people who would normally respond to those situations with students were also struggling themselves. So they welcomed us to come in and work with the Ministerial Alliance. So we want to be helpful when we can. We appreciate, as always, your support. We'll follow up with your appointed board member. You're allowed to appoint two, so if you have anybody else who's interested. Also being on the board, Carol Rogers was on our board for years and years and years. Made this trip up here many times, and Carol was always a great advocate for the county as well as for the mental health center. Any questions that we can answer for you all?
How does fair share funding model? Can you go through that with us?
Absolutely. So, years ago, I've been at the Mental Health Center for 36 years. So, during that time, there were, because there are 20 counties that are involved in the development of the mental health center, there were times when some counties felt like other counties weren't contributing their fair share. So the board actually put together a committee, and they came up with the fair share model. So it's based on 6 points. Population makes up 16.67%. Valuation, same amount. Patients served, same amount. Salary, so if we have an employee who lives in the county, then that's taken into account, because like Ellis County is where the majority of the employees live, so they get a disproportionate benefit, the county does. So if you don't have any employees, then that 16% for you is zero. 16% is just across the board that everybody pays. And then if you have a full-time office, so in that original, can I borrow that? Yeah. Map, those counties with stars have full-time offices, so they have a 16.7% share for that. So every year that we have population valuation data, that's all put into that formula, which comes up for the amount based on that model for each county. We haven't asked for any increase in county funding for decades that I'm aware of, because we know counties have a lot of issues that they're dealing with, and sometimes get things pushed down on them from the state, kind of unfunded mandates that they have to do. Does that help?
Yeah, there's red in here, and I just don't understand the red. Like Ellis County is 95%. Norton's at 89, 81 in Wallace. What does that mean?
I think if you look at the funding request for 2023 versus the actual budgeted county funding level, if there is a difference in those two numbers, then the percentage represents what the actual amount versus the request is. So for like Ellis County, it is the difference between those two numbers, like the 2023 budgeted funding as a percentage of the 2024 benchmark. So Ellis's has gone up from 280 to 296, so
So
that means.
they're gonna ask for 16,000 more?
Right, right. Based again on those 6 factors. So if that,
I think that's really helped me, because you're telling me that if they have a full-time office, they're maybe paying more?
yes, right.
Because that was kind of bothering me. It looked like it was opposite to me.
No.
When I was looking at it.
Sure, that's the, because there's benefit, right? You get employees.
Well, yeah,
and-
they're spending money in your
Yes.
community and paying taxes.
Right, and there's easier access to those services, so the benefit there is why they end up having to pay more.
No, that makes me feel better. Because I was looking at that going like, well, it doesn't seem like they're paying their fair share.
Right, and that,
And I'm a firm believer in high plains mental health, don't get me wrong.
no, sure,
I'm a
we,
supporter of it.
that was really that discussion had been going on for years and years, where, and like I said, I live in Trigo County, and at one point, we had some commissioners who came in and they were like, we don't think we should be funding this, and it doesn't say that there's any amount we have to fund, so we're gonna give you $300. And it had been like close to 25,000. And so the board sent them a letter and said, hey, we've worked on this formula, that's why it's there, and it's our attempt to be fair for everybody, but if you're not gonna do it, then you're going to lose in terms of your county residents will not be able to get a sliding scale fee anymore. They're gonna have to pay full service. And we had a number of meetings with them, trying to figure out what the issues were, and they said, oh, well, we're hearing from the school, they're not getting what they need, so I would go to the school and say, hey, is that right? And they'd say no, and so I bring school people to meetings, and finally, plus I think there was some pressure from county commissioners and counties next to them going, come on, we're all in this together. You guys gotta do your fair share. And eventually we got through that.
Well, I appreciate it. 'Cause
Sure.
I was confused.
Well, and I think, like I said, that was the whole reason that committee of the board kind of went through and said, how do we make this as fair as possible and as transparent as possible, so everybody knows exactly how this works. So I appreciate your asking the question. Any other questions we can answer for you all?
Mm-hmm.
All right, well, thank you again for the time, we really appreciate it, and if you become aware of any concerns in the community, please don't hesitate to reach out. I'll leave my card for you all, and one other issue I'll just touch on briefly is you've probably heard from your sheriff and maybe your hospital administrator that there have
Can I
been
get
some
another
issues
one
at
from each of you?
Larned State
I'll put 'em-
Hospital
I'll put 'em
in
in- like I
terms
said, I
of
got
getting
office
people
here.
in down there.
Can I get one more card?
Sure.
I'll put them in my offices.
Really, for the first time in my career, we've had issues with there not being available beds at Larned. They are funded, budgeted and funded for 94 beds, but they're currently operating at 74, and that's strictly a staffing issue. They just don't have the staffing. The legislature has funded a new hospital, 50 beds, that will be down in the Wichita area. That's good for us because Wichita sends their patients to Larned. So keeping those folks in that area will take pressure off of Larned, and it will decrease the likelihood that we will have these kind of issues where we screen somebody and say, yeah, they need to be in the state hospital, and then the state hospital says, we don't have a bed, so they're gonna have to sit wherever they are, and that's usually in an ER or in a jail, and neither of those are appropriate places. So, in the long run, that pressure will be reduced, but I don't see the issues at Larned going away. You know, I mean, we're having struggles hiring people, and Larned is, you know, in a situation where it's harder and harder to draw people to that community. So I'm glad that they're building those beds, and that will help take some of the pressure off. We also, thanks in large part to Senator Billinger, who really pushed to get the children's inpatient unit back in Hayes. KBC used to have a unit there. They closed it, moved those beds to Wichita. We complained kind of loudly that, boy, that's a big stretch of the state where there aren't any beds. And Senator Billinger really, really worked hard and got money allocated. And so Camber just reopened a couple months ago for children's beds, which is good because we literally had families who recognized their kids needed that level of care, but weren't going to send them all the way to Wichita or Kansas City. They didn't want them to be that far away. So that's good. We still don't have any adult beds in our 20 counties, but it's nice to have that resource back in our area.
Yeah.
All right, well, thank you, gentlemen. Have a great
Thank you
rest
for
of
coming
your
out.
day.
Thank you.
And just as a final note for my department, prevention, education, and outreach, prior to the grants, we were one staff member who was trying to visit all 20 counties every year. Now there's 3 of us full-time. And so I'm the liaison for Cheyenne County, and I've been here 4 or 5 times in the past year. So if you ever need me, give me a call, and I'll be around.
I got you.
If you have any
Thank you for coming out.
Yeah, thank you.
help with it, don't hesitate to reach out. Thank you so much, gentlemen.
Thank you.
Good to see you.
Good to see you. Drive safely with that.
Take care.
Enjoy your day.
Thank you.
Thank you.
Thank you, sir.
Roger needs a recess.
Okay.
Roger needs
We gotta
a quick
quick bathroom,
recess.
okay, guys.
Oh,
So you can sit down.
okay.
Hold the chair up.